Hello, class. This week we are in Chapter 4 in our text and exploring methods of assessment. Assessment is an essential component of the counseling process. It allows us the opportunity to measure, diagnose, probe, explore, and evaluate our clients so that we can come to better understand their issues, their challenges, their problems for the purpose of making that diagnosis. It's the first stage of the treatment process. It's fundamentally important that without proper evaluation, assessment, and diagnosis, how are we then able to work with our clients in developing an effective treatment plan to address their issues, their problems, why they're coming to counseling, and thereby help them meet their goals? Assessments do come in many forms, which can be formal or informal. The direct experience captures the client-reported experiences directly from them. The indirect gathers information from secondary sources. Narrative recording involves capturing detailed accounts of a client's story. This includes their thoughts, their feelings, their behaviors, and significant life events. This approach emphasizes the importance of understanding the client's perspective. The client themselves often then find meaning and healing through telling their story. We may often use various techniques to facilitate narrative recording, such as reflective listening, open-ended questions, creating that safe space for expression. The recorded narrative serves as a reference for both the counselor and the client. And again, it ensures that the dialogue, the discussion, the narrative recording is rooted in the client's lived experience. It's a powerful tool that allows us to document and analyze client interactions and experiences. And as I said, it not only enhances our understanding of the client's journey, but it furthermore supports the therapeutic process by fostering a deeper connection between the client and the counselor. By encouraging clients to share their stories and reflecting on those narratives, we can, alongside the client, work with them to create effective treatment plans, strengthen the therapeutic alliance, and facilitate their personal growth. Narrative recordings can be categorized as both direct and indirect. Interval recording is a powerful technique that's employed in counseling by means where we track and analyze our clients' behaviors and responses over specific time frames. This method involves observing and documenting the frequency, duration, and intensity of a particular behavior within a session. Its utility extends across various therapeutic settings, enhancing both our understanding of the client's needs and the efficacy of treatment interventions. Interval recording in counseling serves as that bridge between the subjective client experience and the objective data analysis. By systematically documenting behaviors over these predetermined intervals, we're thus better able and equipped to understand our clients, assess their progress, and adjust therapeutic strategies accordingly. Ultimately, when used thoughtfully, this technique contributes significantly to the effectiveness of the counseling process. Again, interval recordings can be characterized both as direct and indirect. Self-monitoring in counseling is a crucial concept, serving as a powerful tool, again, for us and the clients. It involves the systematic observation and recording of one's own thoughts, feelings, behaviors, and reactions. This is the client observing and recording their thoughts, feelings, behaviors, and reactions. This practice enhances the client's self-awareness, promotes personal growth, making it an essential component of effective therapeutic intervention. The importance of a client's own self-monitoring lies in their ability to provide, lies in the ability of the monitoring itself, providing insight to the client in terms of their behavioral patterns, emotional triggers. Through client self-monitoring, clients can then track their progress over time, identify areas of concern, develop greater self-regulation. Again, this self-monitoring technique is an invaluable assessment aspect that can benefit both the client and us. Self-monitoring empowers the client, as I said, to become more aware of their internal and external responses. Interval recordings can be characterized as an indirect assessment tool. Behavioral interviews in counseling have become a fundamental tool. They enhance both the assessment and the therapeutic process. Unlike traditional interviews that might focus predominantly on past experiences or even hypothetical scenarios, behavioral interviews delve into specific instances of a client's past behaviors in order to gain insight into their personality, their coping strategies, and their emotional responses. This approach not only aids us in understanding our clients more deeply, but again fosters that therapeutic environment grounded in reflection and real-life application. At the heart of behavioral interview lies the premise that past behavior is often the best predictor of future behavior. By exploring concrete examples from a client's life, we can identify patterns that may illuminate underlying issues or strengths. The behavioral interview assessment technique represents a tool that promotes that deeper and depth of understanding for the client. There are often uncovered valuable insights into the client's thoughts, feelings, and behaviors. Interviewing is that fundamental component of the assessment process. It's the way by which we gather information that informs the therapeutic process. This practice transcends mere conversation. It's rather designed to elicit insights into a client's thoughts, emotions, behaviors. Through effective interviewing, we can establish rapport, identify issues, and ultimately with the client develop a treatment plan tailored to their unique needs. At its core, interviewing and counseling involves creating that safe, supportive environment where clients feel comfortable sharing their experiences. This necessitates us employing our core counseling skills, which are based in active listening, demonstrating empathy, showing genuine interest in the client's narrative. Establishing trust is paramount, as clients are more likely to open up to us about their struggles when they perceive us to be understanding and non-judgmental. We often begin with open-ended questions that encourage clients to elaborate. Allowing them to explore their experiences, seeking deeper meaning of their personal history. The structured nature of counseling interviews can take various forms, including intake interviews, diagnostic interviews, and ongoing counseling sessions aimed at assessing progress. In an intake interview, we gather essential background information such as the client's history, presenting problems, and their goals for therapy. The comprehensive assessment helps us then crystallize the issues that need to be addressed and lays the groundwork for a collaborative therapeutic relationship. Diagnostic interviews follow suit, utilizing standardized tools to identify potential mental health disorders based upon the diagnostic criteria set forth in manuals like the DSM-5. During the interview process, we pay particular attention to nonverbal cues. These can provide insights into the client's emotional state. Body language, facial expressions, and the tone of voice can reveal feelings that might not be articulated verbally. Effective interviewing also requires cultural competence. We must remain and be aware of a client's cultural background and how it can influence their beliefs, values, and communication styles. Sensitivity to cultural nuances can enhance the therapeutic alliance and ensure that our assessments are not only accurate but respectful of the client's identity. This cultural awareness further supports the creation of a safe space where clients feel validated and understood. Ultimately, interviewing as part of assessment and counseling is not just that procedural step. Rather, it's an art that combines skillful questioning, empathic engagement, and a nuanced understanding of human behavior. The insights gained through this process guide the direction of therapy and significantly impact a client's journey toward healing and personal growth. Counseling interview methods are essential tools that are utilized by us as counselors, by which we use to gather information, understand the client's issues, and facilitate effective therapy. One of the most fundamental techniques is the structured interview. In this method, the counselor uses a predetermined set of questions. We follow a specific format to ensure consistency in the information gathered from our clients. Structured interviews are particularly useful when assessing diagnostic criteria, as they allow for comparisons across various cases. This method ensures that no critical area is overlooked, providing a comprehensive understanding of the client's situation. However, while structured interviews can yield reliable data, they may sometimes limit the depth of discussion and spontaneity, which might arise during more open-ended formats. Semi-structured interviews combine elements of both structured and unstructured methods. We prepare a set of core questions, but retain the flexibility to explore topics in more depth based upon the client's responses. This method strikes that balance between obtaining essential information and allowing for the natural flow of the conversation. Semi-structured interviews are commonly used in various therapeutic settings, thereby enabling us as counselors to gather valuable insights while still accommodating individual client experiences. Unstructured interviews offer a more flexible format. This allows clients to express themselves more freely. This method encourages the exploration of thoughts, feelings, and experiences without those predetermined questions guiding the conversation. We might, as counselors, use unstructured interviews and initiate conversation with very broad prompts, such as "tell me about yourself," or "what brings you here today." This approach leads to deeper insights, as clients often reveal underlying issues that they might not disclose when in more rigid structures. This method does have potential downsides. It can lead to irrelevant tangents, and essential issues may get overlooked without a guiding structure. In conclusion, counseling interview plays that vital role in the therapeutic process. Each method has distinct advantages and limitations. The choice of which to use often depends on the individual needs of the client and their specific goals of therapy. The biopsychosocial spiritual model is an integrative framework that emphasizes the interconnectedness of biological, psychological, social, and spiritual factors in understanding human health and well-being. This holistic approach recognizes that health is not merely the absence of disease, but rather a complex state influenced by a multitude of elements. According to the biopsychosocial spiritual model, adopting it ultimately supports improved health outcomes by promoting an understanding of health from that multidimensional context, which leads to more effective interventions that enhance the overall quality of our client's life. Biologically, it considers genetic predispositions, physical health, neurobiology, and the impact of disease or injury. Psychological factors often include the cognitive processes, the emotions, the behaviors, and mental health status. These all contribute to how an individual perceives and responds to health challenges. Social influences encompass family dynamics, cultural norms, socio-economic status, and community interactions, highlighting the importance of social support and relationships. Spiritual dimensions address personal beliefs and values, the search for meaning, all of which can significantly affect an individual's coping strategies and overall health. This part of the model acknowledges that spirituality can provide comfort, purpose, and resilience during difficult times. By utilizing the biopsychosocial spiritual framework, we can provide and develop more comprehensive treatment plans that account for that full array of factors impacting our clients. This approach encourages collaboration among various health professionals. It fosters a patient-centered model of care where treatment is tailored to meet the unique needs of each individual client. Initial counseling intake assessment plays that crucial role in the therapeutic process as it lays the foundation for the entire counseling journey. During the intake assessment, we gather essential information about the client, such as their presenting concerns, mental health history, and goals for therapy. This information helps us better understand the client's needs and then work with them to tailor the treatment plan. One of the primary purposes of the initial counseling intake assessment is to establish the therapeutic alliance between the client and us. Building rapport and trust with the client is essential for creating that safe, supportive environment for therapy to take place. The counselor uses the intake assessment to get to know the client, to form an initial understanding of their background, personality, and concerns. Our author presents a four-phased approach to navigating the initial intake assessment. Phase 1, the initial contact and initial intake information gathering. Phase 2, the clinical intake interview. Phase 3, the diagnostic interview. And Phase 4, a synthesis. In addition to building rapport, the initial contact serves as that opportunity to gather the essential intake information from the client. This information typically includes personal details such as the client's name, age, contact information, a brief overview of their presenting concerns. The intake information allows us to gain a better understanding of their background, their history, and the reasons the client is seeking counseling. Pre-screening involves the preparatory tasks that help determine the client's needs and assess immediate risks, such as intake documentation that may be relevant to the therapeutic setting. Within this realm, we find the transparency of client rights, insurance verification, risk screening, and informed consent. Secondary benefits of this pre-screening include the opportunity for the client to share their motivation for seeking counseling, their readiness, and potential resistance. The intake assessment allows us to gather that information about the client's current symptoms and experiences. This information helps us make an accurate diagnosis and develop with our clients a treatment plan that's tailored to their specific needs. The intake assessment also helps the client to clarify their goals and expectations for counseling. By discussing their concerns and desired outcomes with us, the client can also gain a better understanding of what to expect from the counseling process. This helps ensure that both the client and the counselor are on the same page, working towards the same goals. The initial counseling intake assessment is a crucial first step in that therapeutic process, as I referenced. By participating in the intake assessment, clients gain a better understanding of that counseling process they're entering into, and hopefully feel more empowered to work towards their goals. Ultimately, the intake assessment sets the stage for the successful counseling experiences of our clients and lays the groundwork for positive outcomes. Informed consent is a fundamental ethical principle in counseling that ensures that clients are fully aware of the nature, risks, benefits, and alternatives to any proposed treatment or intervention. It is an essential aspect of the therapeutic relationship that promotes transparency, autonomy, and respect for the client's right to make informed decisions about their mental health care. When a client enters into counseling, they may be experiencing a range of emotions, challenges, and vulnerabilities. It's crucial for us as counselors to provide clear and comprehensive information about the counseling process, about confidentiality, about fees, about the limitations of confidentiality, treatment goals, about potential risks or benefits associated with the proposed interventions and the counseling process. By obtaining informed consent from the client, we empower them to actively participate in their treatment and make informed choices about their mental health care. It's important to note that informed consent is an ongoing process that involves ongoing dialogue and collaboration between the counselor and the client. As counselors, we must ensure that clients have the opportunity to ask questions, to seek clarification, to provide input into their treatment plan. Our clients should always be informed of their right to refuse or withdraw consent at any time during the counseling process, without any negative consequences. Informed consent is especially important when working with vulnerable populations, such as minors, individuals with disabilities, or individuals who may have difficulty understanding the counseling process. In these cases, we must take the additional steps necessary to ensure that our clients fully understand the information provided and are able to provide genuine consent to participate in counseling. Informed consent is not just a legal requirement, it's a moral imperative that upholds the principles of beneficence, autonomy, and non-maleficence in counseling. By obtaining informed consent from clients, we demonstrate their commitment to ethical practice, respect for their autonomy, and provide transparency in the therapeutic relationship. The mental status exam is a crucial component of a comprehensive psychiatric or counseling or psychological evaluation. It is a structured assessment tool used by mental health professionals to evaluate various aspects of a person's mental functioning, including their emotional state, cognition, behavior, and overall psychological well-being. The MSE consists of several components that help clinicians assess a person's current mental state. These components include assessing the individual's appearance, behavior, speech, mood, affect, thought content, thought process, perception, cognition, insight, and judgment. Each of these components provides valuable information about the individual's mental health status and helps us formulate an accurate diagnosis and treatment plan. One important aspect of the MSE is assessing the individual client's appearance and behavior. This involves us observing how they present themselves, their level of hygiene, grooming, and overall physical appearance. Behavior refers to the individual's actions and responses during the evaluation, such as the client's level of cooperation, any agitation, or restlessness. Assessing our client's speech is another important component of the MSE. We evaluate our client's rate of speech, their volume, tone, and articulation. Changes in speech patterns can provide important clues about the client's mental health status. The assessment of mood is also, and affect, is also another critical component of the MSE. Mood refers to the individual's emotional state, such as whether they feel sad, anxious, or irritable. Affect, on the other hand, refers to the individual's emotional expression, such as whether their facial expressions and body language are congruent with their reported mood. The MSE also includes an evaluation of the person's thought content and thought process. We assess the client's thoughts for evidence of delusions, hallucinations, or obsessions. Thought process refers to the logic and organization of our client's thoughts, such as whether they are coherent and goal-oriented. Perception is another important aspect of the MSE. It involves assessing the client's sensory experiences, such as any auditory or visual hallucinations they may be experiencing. Cognition evaluates the client's level of attention, memory, concentration, and problem-solving abilities. Insight and judgment are also assessed during the MSE. Insight refers to the person's awareness of their mental health issues, while judgment refers to the client's ability to make sound decisions and understand the consequences of their actions. The MSE is a vital tool used by mental health professionals and counselors to evaluate our client's mental health status. By assessing our client's appearance, behavior, speech, mood, affect, thought content, thought process, perception, cognition, insight, and judgment, we gain valuable insight into our client's mental functioning and thereby develop an appropriate treatment plan. The MSE helps us make accurate diagnosis, monitor treatment progress, and provide optimal care for our clients. The diagnostic interview is also a crucial tool used by us to assess our client's mental health status and determine an appropriate course of treatment. This type of interview is typically conducted by psychologists, psychiatrists, social workers, and other mental health professionals who have received specialized training in conducting diagnostic interviews. The diagnostic interview typically begins by gathering information about the individual's presenting symptoms and concerns. This may include questions about the individual's mental health history, family history, medical history, and any recent life events that may have contributed to the individual client's current mental health issues. We may ask questions about the client's use of medications, alcohol, other substances, both legal and illicit. And we also ask questions that pertain to the client's history of trauma or abuse. Once we've gathered all this information, we move on to specific questions about the client's presenting problems and symptoms. These may include questions about their mood, their thoughts, their behaviors, or any physical symptoms they're experiencing. We may also ask about the duration and severity of these symptoms, as well as factors that may exacerbate or alleviate their symptoms. In gathering all this information, the diagnostic interview also involves the use of standardized assessment tools that help us make a more accurate diagnosis. These assessment tools may include questionnaires, rating scales, or other measures that can help us identify specific mental health disorders or symptomatology. The diagnostic interview is a crucial and critical step in our assessment and treatment process. Case conceptualization is a crucial aspect of the assessment process. It involves synthesizing information gathered from all the various assessments to develop a comprehensive understanding of our client's functioning. By integrating data from multiple sources, we create a holistic picture of the client's presenting issues, personality traits, and potential treatment options. The synthesis of assessments into case conceptualization allows us to gain a deeper understanding of our client's unique strengths and challenges. By examining the results of tests and diagnostic interviews, by examining and reviewing behavioral observations, we can identify patterns and themes that might contribute to the client's difficulties. This thereby integrates information in a way that we are able to synthesize and again paint the picture of the experiences of our client and all the information that has been gathered. One of the key benefits of synthesizing assessment into case conceptualization is the ability to tailor the intervention to meet the individual needs of the client. By combining information from different assessment tools, we identify the most effective treatment strategies for the client's specific concerns. Case conceptualization also allows us to track the client's progress over time and make adjustments to treatment strategies accordingly. We regularly review and update the case conceptualization. We ensure that our interventions are aligned with the client's needs and goals. This adaptive approach maximizes the positive outcomes and promotes client engagement and motivation. Translating assessment into action is a crucial step in the process of evaluating progress and making improvements. Assessment involves collecting data, analyzing results, identifying areas for growth. However, the real impact comes when this information is translated into actionable steps. One key aspect of translating assessment into action is by setting specific and measurable goals. By clearly defining what it is the client wants to achieve, we can help create a roadmap for success. Taking action based on assessment results requires a commitment to continuous improvement. It's not enough to simply identify areas for growth. We must be willing to implement and work with our clients in terms of the changes they want to implement and monitor over time. This may involve check-ins, data analysis, and adjustments as needed. You'll note that the intake report provides that groundwork by which we collect the essential information. The case conceptualization, as I said, is derived from the detailed understanding of the client's needs and is often rooted in our theoretical orientation. That collaborative treatment plan is what is co-created with the client. The progress notes are what we write post-intake to track and document ongoing counseling interactions. The progress notes capture our approach to understanding the case. We can keep process notes, on our own, and those are what captures our approach to understanding the case, and they should remain separate from the medical record. Interviewing children in counseling can be challenging, but an essential aspect of providing effective therapy and counseling for our young clients. Children often struggle to express their thoughts and feelings verbally, making it crucial for counselors to utilize specific techniques and approaches. One of the most important considerations when interviewing children in counseling is creating that safe and comfortable environment for a child to express themselves. It's important that we pay attention and involve using age-appropriate language, establishing rapport and trust, and that we demonstrate empathy and compassion. Children are more likely to open up and engage in therapy when they feel valued and respected by their counselors. We need to also be sure to recognize the unique developmental needs and limitations of children when conducting interviews. We must also pay attention in terms of observing their behavior through active listening. Children often communicate their thoughts and feelings through play and art and other activities rather than traditional conversation. We must pay particularly close attention to nonverbal cues, as these can gain valuable insight into the child's inner world and experiences. It is important that we be mindful of ethical considerations and boundaries when interviewing children. While we must obtain informed consent from both the child and the parent or guardian before beginning therapy, this is crucial. Confidentiality should be maintained unless there is a risk of harm to the child or others. Interviewing children requires a sensitive and thoughtful approach that must take into account the unique needs and challenges of our young clients. Assessment and counseling, formal versus informal. Formal and informal assessments are two essential tools used in counseling settings. These help us better understand our clients and tailor interventions to suit specific needs. Formal assessments are standardized tests or instruments that are administered in a structured and controlled environment. They are typically psychometrically sound and have established reliability and validity. Formal assessments are often used to measure specific constructs, such as depression, anxiety, personality traits, or cognitive abilities. Informal assessments are more flexible, less structured. They may involve observations, interviews, self-report measures, checklists, and rating scales. Informal assessments provide us with valuable qualitative information about our clients' experiences, perspectives, and behaviors, and are most often used to gather information about a client's strengths, challenges, and goals. Both formal and informal assessments have advantages and limitations. Formal assessments do provide standardized and objective data, which can be compared to normative data and can be used to track changes over time. However, formal assessments may not capture the full complexity of a client's experiences or provide a complete picture of their needs. Informal assessments, on the other hand, offer that more nuanced understanding of a client's unique circumstances and can help build rapport and trust in the therapeutic relationship. However, informal assessments may be less reliable and valid than formal assessments, may be subject to biases or interpretation errors. In counseling practice, it's crucial to use a combination of both formal and informal assessments to gather that comprehensive understanding of our clients. By using a variety of assessment tools, we can develop a holistic understanding of our clients and tailor interventions to meet their unique needs. Additionally, ongoing assessment throughout the counseling process allows us to monitor progress, adjust treatment goals, and ensure that clients are receiving the most effective care possible. Ultimately, formal and informal assessments play a vital role in supporting our clients on their journey. Assessment plays that crucial role in the counseling process as it helps us better understand our clients. There are two main types of assessments used in counseling: standardized and non-standardized. As I mentioned, standardized assessments are those formal tests that have been normed on a specific population and have established validity and reliability. These assessments provide quantifiable data that can help with making informed decisions about a client's mental health needs. While these standardized assessments provide valuable information, they do have their limitations. They may not capture the full range of a client's experiences or emotions, as they are limited to the questions included on the test. Additionally, standardized assessments may not be culturally sensitive, as they are often developed and normed on specific populations. Non-standardized assessments are more flexible and individualized. They include interviews, self-report measures, observations, and informal assessments. Non-standardized assessments allow us to gather that more nuanced understanding of our clients' experiences and then tailor interventions accordingly. Non-standardized assessments can be particularly useful in working with clients from diverse cultural backgrounds, as they allow us to explore the unique experiences and values of our client. Additionally, non-standardized assessments can help build rapport and trust between the client and us, as they often involve more open-ended discussions and conversations. Both standardized and non-standardized assessments have benefits and limitations. Using a combination of both of them is important in our practice. Verbal assessments play a crucial role in helping clients explore their thoughts, emotions, and behaviors. This form of assessment involves us asking questions and engaging in conversation with the client to gain a deeper understanding of their experiences and concerns. By using verbal assessment techniques, we can identify underlying issues, establish rapport with our client, and develop treatment plans tailored to their unique needs. One benefit of verbal assessments is that it allows for a more in-depth exploration of the client's feelings and experiences. Through open-ended questions and active listening, we can help clients articulate their thoughts and emotions, leading to greater insight and self-awareness. Verbal assessments provide an opportunity for clients to reflect on their behavior and motivations, which can help them identify patterns and make positive changes in their lives. Nonverbal assessment in counseling provides a crucial aspect of understanding a client's emotions, thoughts, and behaviors that without relying solely on verbal communication. While verbal communication provides important insights, nonverbal cues can reveal underlying emotions, attitudes, and beliefs that may not be expressed verbally. Nonverbal communication includes a wide range of cues, such as facial expressions, body language, posture, gestures, eye contact, and tone of voice. These cues provide valuable information about our client's feelings, a level of distress, resistance, or their engagement in the counseling process. During a counseling session, we may observe a client's body language to assess their level of discomfort or anxiety. Facial expressions provide the key component of nonverbal assessment. They can reveal a wealth of emotions. Gestures and body languages can provide insight into a client's emotional state and their attitude. It's important to pay attention to nonverbal cues, as they can help us better meet and understand our client and facilitate a more effective therapeutic relationship. Group assessments provide valuable insight into each individual's unique needs and strengths within the group dynamic. By evaluating the members of the group as a whole, we can develop more effective treatment plans and interventions that address the concerns of each individual, while also fostering a sense of community and support among group members. A valuable asset is the opportunity for individuals to gain insight into their own behaviors and thought patterns through the reflections and feedback of others. For in a group setting, clients receive feedback from each other, who may have had and often have had similar experiences, similar perspectives, thus providing a broader context for understanding their own unique struggles and strengths. This helps clients develop greater self-awareness and empathy for others, leading to increased self-acceptance and growth. Group assessment allows us to observe how individuals interact with each other and respond to group dynamics. This provides valuable information about their social skills, communication styles, and relational patterns. By analyzing these interactions, we can identify areas for growth and development, as well as potential triggers or challenges. Group assessment in counseling can help clients build a sense of belonging and connection with others. By sharing their experiences and perspectives, they feel less alone in their struggles, feel more supported in their journey. This sense of community can foster a greater sense of accountability and motivation, encouraging clients to take ownership of their progress and to actively engage in the counseling process. Individual assessments allow us to gain a deeper understanding of a client's needs, their strengths, and areas for growth. During assessment, clients gather information through various methods. One of the primary goals of individual assessment is to establish a strong therapeutic relationship between us and the client. And throughout the assessment process, we aim to build trust and rapport with our clients, creating a safe and supportive environment for exploring their personal issues and working towards positive change. By gaining insight into the client's unique experiences and perspectives, we are thus better able to tailor and approach our interventions to meet their needs and hopefully lead to more effective and meaningful therapeutic outcomes. Individual assessment serves as a foundation for developing treatment plans and interventions which are tailored to that individual client's specific needs and goals. By identifying the client's strengths, challenges, and preferences, we further create a roadmap for therapy that is personalized and effective. This individualized approach can help clients feel more empowered, more motivated to engage in the therapeutic process. Additionally, individual assessment provides valuable insights into the underlying factors that perhaps are contributing to the client's presenting issues. By exploring the client's personal history, relationships, life experiences, we can gain a deeper understanding of the root causes of the client's struggles, allowing for more targeted and effective interventions. This holistic approach to assessment can help our clients develop greater self-awareness and insight, leading to lasting personal growth and change. Objective and subjective assessment are two components in the counseling process that help us better understand our clients' needs and create therapeutic treatment plans. Objective assessment refers to the use of standardized tools and measures to gather information about a client's symptoms, behaviors, and emotions. Again, all these assessments are typically quantitative in nature. On the other hand, subjective assessment involves us gathering information directly from the client through conversation, observation, and self-report measures. These assessments are more qualitative in nature. Both objective and subjective assessments are valuable in counseling because they provide different types of information that can be used together to create a comprehensive understanding of the client's mental health. It's important that we do use a combination of both objective and subjective assessment techniques to ensure that we have a complete picture of our client's mental health. By gathering both quantitative and qualitative data, we again can tailor interventions to meet the individual needs of our clients and provide for more effective and holistic care. Different assessment formats can vary and are tailored to various clients in terms of factors that are specific and unique in terms of categorical or populations, such as age, culture, or disability. Noting these client factors and being intentional about format selection is crucial for us. You see that there are several examples of formats outlined on the slide and which you read about in the text. Screening inventories are tools used in counseling to assess a client's mental health, emotional well-being, and overall functioning. These inventories are often administered at the beginning of counseling to gather important information about the client's symptoms, behaviors, and concerns. Screening inventories can help us identify potential mental health issues, establish a baseline for treatment, and track progress over time. Screening inventories are valuable tools because they provide a structured way to gather information. By using these inventories, we can quickly assess a client's symptoms, identify mental health issues, and develop appropriate treatment plans. Screening inventories help us track changes in our client's symptoms over time, thus allowing us to make adjustments as needed. They are useful tools in counseling. They're just one part of the assessment process. It's crucial to use clinical judgment and consider the client's unique experiences, backgrounds, and circumstances when interpreting the results of screening inventories. Screening inventories should always be used as part of a comprehensive assessment that includes a thorough intake interview, observation, and collaboration with the client, such that we gather as much information as possible. Rating scales provide us with quantitative measures of clients' progress and well-being. These scales help us assess the severity of clients' symptoms, monitor changes over time, and determine the effectiveness of interventions. By using rating scales, we can gather valuable information that guide treatment plans and decision-making processes. One common type of rating scale used in counseling is the Lecturette scale, which asks clients to rate their experiences or feelings on a scale from strongly disagree to strongly agree. Lecturette scales are easy to administer and can provide us with a quick snapshot of our client's thoughts and emotions. In addition to measuring emotional and psychological symptoms, rating scales can also be used to assess other aspects of a client's well-being, such as stress levels, social support, and quality of life. Checklists are also another valuable tool that can help us stay organized and focused during counseling sessions. These simple lists provide structure, enhance communication, and ensure that important topics are covered. A major benefit of using checklists in counseling is that they can help us remember important details and track progress over time. By having a checklist of topics to cover during each session, we can ensure that we are addressing all key issues and goals. This can help clients feel more supported and understood, as their concerns are being actively listened to and addressed. Checklists can also help establish a sense of direction and purpose during counseling sessions. They can help both the client and counselor understand what to expect and set clear goals for the session. This can prevent sessions from veering off track or becoming unproductive. Checklists can help guide the conversation towards important topics and ensure that the client's needs are being met. Checklists can also improve communication between us and our clients. They can provide a visual aid that can help both client and counselor stay focused and engaged. Clients can see what topics are being covered and have a chance to provide feedback or ask questions. This can enhance the client's understanding of their own progress and empower them to take an active role in their counseling. Checklists can also be used as a tool for self-assessment and reflection. As counselors, we can use them to evaluate our own performance and identify areas for improvement. This helps us stay accountable and continuously strive to provide the best possible care for our clients. Biological measures involve the use of biological information, such as genetics, neurobiology, and other physiological factors, in the assessment and treatment of mental health issues. These measures provide valuable insight into a client's mental health and can help us once again tailor interventions that are effective and personalized. Document analysis in counseling is a crucial aspect in that it involves us examining the various forms of written communication in order to gain insight into a client's thoughts, feelings, and behaviors. These documents can include intake forms, progress notes, assessments, treatment plans, and other written materials generated during the course of counseling. One of the key benefits of document analysis is that it provides a comprehensive and objective record of the therapeutic process. By reviewing these documents, we can track clients' progress over time, identify patterns and themes in their behavior, and evaluate the effectiveness of interventions. This information can help us make informed decisions as we work with our clients in treatment planning, adjusting treatment goals as approaches as needed, and assure that clients are receiving the best possible care. Document analysis can also be a valuable tool for building rapport and trust with our clients. By taking the time to review and discuss written materials with them, we demonstrate that they are actively engaged in the therapeutic process. This can help clients feel heard and supported, leading to deeper therapeutic connection and positive outcome. Document analysis can also help us understand a client's unique strengths, challenges, and needs. Projective assessments. They can help us gain insight into our clients' thoughts, feelings, and behaviors. These types of assessments involve presenting clients with ambiguous stimuli, such as images or stories, and asking them to project their thoughts and feelings onto the stimuli. By analyzing the client's responses, we can uncover subconscious thoughts and emotions that may be influencing our client's behavior. Projective assessments can be particularly useful when working with clients who have difficulty expressing their emotions verbally. By presenting clients with ambiguous stimuli, we can bypass the client's conscious defenses and access a deeper subconscious thought and feeling area of our client. This can be especially beneficial when working with clients who have experienced trauma or who struggle with verbal communication. Despite these benefits, projective assessments are not without their limitations. Critics argue that these assessments lack standardization and reliability, making it difficult to interpret results consistently across clients. Additionally, some research has shown that projective assessments may be susceptible to bias and interpretation errors, which could potentially lead to inaccurate conclusions. Observation assessments. They allow us to gather valuable information about our clients' behaviors and interactions. By observing our clients in real-life settings, we can gain deeper insight into their thoughts, feelings, and relationships, which can inform the counseling process and help the clients achieve their goals. One of the primary benefits of observation is that they provide us with that more holistic view of our clients. By observing clients in action, we can see how they interact with others, how they handle stress, how they navigate challenges in their daily lives. Observation assists us in assessing clients' progress more effectively. Observation assessments can potentially help us identify underlying issues that may not be immediately apparent through other assessment methods. You'll note that there are some other non-traditional methods and assessments highlighted on the slides from the text. These include graphic assessments, art-based assessments, autobiographical methods. Thank you for your work on this chapter, and I hope you enjoyed this lecturette on methods in assessment.